Hello, I'm Dr. Brady Wyrick, and I'm a board-certified chiropractic neurologist. I'm the clinical director of Idaho Chiropractic Neurology, and I've spent the last 4 years in East Idaho studying and practicing how to change the lives of people with chronic conditions, including chronic spinal pain. Are you tired of living with back or neck pain? You have a herniated disc, a facet syndrome, degenerative joint disease, failed back surgery, or numbness in your hands or feet? What I'm going to share with you in the next few minutes will change your life. Let me talk to you about the benefits of what we call non-surgical spinal decompression. The first benefit is that it is FDA approved. It's also painless. It has saved thousands of people just like you from surgery. The question is, are you next? So how does spinal decompression work? Well, your symptoms are caused by abnormal pressure on the nerves that exit your spine. Spinal decompression creates negative pressure within the discs, allowing the disc to heal and restoring proper nerve flow. Let me show you what I mean. This is a model of the lumbar spine. Okay? And if you stop right here, you can see this bulge sticking out that's compressing this nerve root. Okay? This bulge is causing abnormal pressure on this nerve, and this nerve goes down to areas in your lower extremity. This abnormal pressure causes the symptoms of back pain and leg pain. Now what spinal decompression does, and I'll show you the machine here momentarily, but it creates a negative pressure by providing traction this direction on the spine. Okay, when the spine is lifted like this, it stretches lengthwise, it creates negative pressure within the disc itself, and that material is drawn back into its normal position, and it's given the chance to heal. Spinal decompression and chiropractic neurology are a winning combination. Let me share with you why. An area of your brain called the cerebellum that sits right here at the base of your skull controls three things. It controls balance and coordination, eye movements, and spinal muscles. It's the spinal muscle control that controls the big muscles around the spine. When this control is lost, the spine muscles contract, causing abnormal pressure, causing discs to degenerate, and causing herniated discs. Chiropractic neurology will give the cerebellum fuel and activation to make it stronger, removing the root of the problem, allowing those muscles to relax and taking pressure off that disc while doing spinal decompression. Now, I started using, I've been doing spinal decompression since 2006. When I started applying chiropractic neurology with spinal decompression, our results skyrocketed. In fact, back in 2007, KIDK aired a story about our office. The story, you can find the story online on my website, but we started using spinal decompression with chiropractic neurology after the story aired, and we got even better results. A statement I like to use is, if you continue to do what you've always done, you're going to continue to get what you've always gotten. The question is where are your priorities? Now, I want you to ask yourself the following questions. How has your chronic back pain affected your job, relationship, finances, and other activities? What has it cost you in time, money, happiness, or sleep? Where do you picture yourself in the next 1 to 3 years if we don't take care of your condition soon? And what is it worth to you if we can improve your condition? What I want you to do is call and make an appointment to find out how we can add value to your life. Here's what you need to plan on. You need to plan on giving me about an hour for the exam. You have to bring your spouse if you have one. You must fill out all the paperwork completely and return it the day before your appointment so I have a chance to review all of your paperwork plus any recent imaging that you have to find out if you're a good candidate for this care. I need you to bring a t-shirt and shorts with you to the office. It's impossible to do a complete neurological exam while wearing long sleeves and long pants. And the last thing I want you to do is to watch the DVD again. This DVD contains life-changing information that I'll share with you how you can get better and how you can get through this chronic condition. So call right away. Let us show you how we can add value to your life and show us how we can change your life. Thank you. Now this is our decompression unit. It's a Chattanooga Triton decompression therapy system. Krista's been nice enough to volunteer herself to be our lovely model today to show you how this works. Now, Keep in mind that she's hooked up for cervical traction. Now we can do decompression on the cervical spine, we can do decompression on the lumbar spine. It's just easier for me to show you in the camera cervical decompression. So what's going on here is her head is on a trolley that's connected to this cable. The cable goes into the unit and is controlled by the computer on the unit. Now I don't know if you can see on the screen or not, but when I hit start here, what's actually going to happen is the unit is going to pull between 0 and 10 pounds. Now this is just an example. Everybody's is going to be different, but for Krista's sake, I set it up nice and light just so we could make this easy and so you could see it real well on the, or you may not be able to see it on the screen, but it'll oscillate between 0 and 10 pounds for about 9 minutes. So what this does is it takes those vertebral joints that we talked about and it stretches them back and forth like this over the period of 9 minutes. Each time those joints open up, it allows nutrients to flow into the disc, gives the disc a chance to heal, and then over time, building this up over and over will improve the quality of the disc material, will bring back the disc material and take pressure off the nerve roots and relieve your symptoms. Now, as I said before, we did decompression in this office for about a year. But when we added chiropractic neurology, our results just shot through the roof. And this is one example of chiropractic neurology here where Krista is actually pedaling a hand bike while breathing in oxygen. This is called exercise with oxygen therapy. What this does is it provides fuel and activation to Krista's cerebellum. When you provide fuel and activation to the cerebellum, it allows the muscles of the spine to relax and it makes our treatment more effective.